A very good morning and a warm welcome to all the dignitaries, guests and students. I, Dr. Melissa Lewis, Assistant Professor at Indian Institute of Public Health, feel privileged to extend my warm welcome to today's program on the launch of Bachelor of Public Health and graduation ceremony of Master of Public Health batch of 2019. Let us start by welcoming the dignitaries with flowers. It's an honor to have amongst us the dignitaries, chief guest for today's function, Shri James P.K. Sangma, the Honorable Minister for Health and Family Welfare, Govt of Meghalaya. On behalf of IIPHS Shillong, we welcome you, sir. May I request Dr. Eliza to welcome the chief guest. It's my honor to welcome the guest of honor, Shri Sampath Kumar IAS, Principal Secretary, Health and Family Welfare Govt of Meghalaya. Welcome you, sir. I request Dr. Taimu Jami, faculty, to welcome sir with class. We have amongst us Dr. Eva Monlalu, Registrar, Martin Luther Christian University, Shillong. We welcome you, ma'am. Dr. Baralin, may I request you to welcome Dr. Eva Monlalu. I feel privileged to welcome our dear director, Professor Sandra Albert, and Dr. Rajiv Sarkar, Dean of IIPHS Shillong. Welcome, ma'am. Welcome, sir. We also have amongst us the Director of Health Services Research, Dr. Lyndon. Welcome, ma'am. May I request Dr. Baralin to welcome ma'am. Thank you very much. Please be seated. We now begin the program with a song from the students of IIPHS Shillong. Over to the team.
need somebody to lean on. Just call me brother when you need a hand. We all need somebody to lean on. I just might have a problem that you understand. We all need somebody to lean on. If there is a load you have to bear that you can carry, I'm right up the road. I'll share your load if you just call me, call me, call me, call me, call me.
Thank you very much. I now invite Professor Sandra Albert, Director IIPHS Shillong, to present the Director's report.
Thank you, Melissa, and my apologies for that delay. Despite all the developments in technology, sometimes we have these glitches, I suppose. Good morning to you all. A warm welcome to our Chief Guest, the Honourable Minister for Health and Family Welfare, Shri James P.K. Sangma. Thank you for joining us today. Welcome to Shri Sampath Kumar IAS, Principal Secretary to the Government of Meghalaya. Welcome to the Directors of Health Services, the members of our Board of Governors, our Ethics Committee members, other invitees, students, parents, guardians, graduates and your families, and my dear colleagues. Thank you all for being here this morning. Public health, as you all know, is a multidisciplinary field covering a range of subjects, and medicine is but one discipline in this multidisciplinary field. Public health seeks to understand and address the social determinants and systemic factors that contribute to ill health. A bit of background. Our origins go to an MOU signed by the Public Health Foundation of India with the Government of Meghalaya in 2008 to establish an IIPH in Shillong. The aim was to develop a world-class regional institute of higher education and research in public health. Interim infrastructure was provided by the government in 2014, and in the initial years, we focused our research on research as academic programs were deferred by the PHFI board at the time. In 2017, a proverbial storm hit PHFI. An existential crisis ensued. A decision was to be made regarding IIPH Shillong's future. When one is in a stormy crisis, you could do with a lifeline. All of us could. That came in the form of the then Secretary to the Chief Minister, Shri Sampath Kumar IAS. He reminded me how important this institution would be to the government and its people. And so we chose to weather the storms and climb the steep mountain. And here we are today, in a new avatar. We proceeded to establish a malaria research center, a collaborative initiative with New York University and other partners. The Center for Study of Complex Malaria in India is one of the 11 international centers for excellence in malaria research, or the ISMER initiative, funded by the National Institute of Health, USA. Capacity building, of course, of young researchers and transfer of technology are key components. Here are summary statistics of the CSCMI staff. Over the past 3.5 years, we have provided employment opportunities for over 47 people in this one grant. The majority of them are from Meghalaya, and the Northeast region, and 94% belonged to scheduled tribes. We like keeping our promises. In an attempt to redress the systemic problems within our nation's health systems, in 2017, the National Health Policy recommended that the states to create a public health management cadre. The policy recognizes the multidisciplinary nature of public health and advocates for such trained professionals to be incorporated into the health system. In response to this policy, in 2019, the Indian Institute of Public Health Shillong launched the first Masters of Public Health program in the Northeast region. While we await degree granting status of our own, we have an interim arrangement with the Martin Luther Christian University for our degree programs. While we use the guidelines provided by the Ministry of Health of the nation, we are also constantly adapting to make our courses context relevant. The thought process started with an international seminar that we hosted to discuss the MPH curriculum, and the process continues. A few points on our MPH. We use continuous formative evaluation rather than end-of-year summative examinations. That translates to our students being assessed on almost a weekly basis rather than at the end of the year. We recognize that learning outcomes and skills transfer are far more important than just giving good lectures. We place emphasis on experiential learning. All of this is, of course, based on sound theoretical underpinnings of adult learning principles. Knowledge and comprehension are, of course, required, but at this level, we expect our students to move to higher levels of analysis, evaluation, and synthesis of knowledge. Here is a summary of our MPH students so far. 62% are doctors, and the rest come from other allied fields. Although we intend to cater to the Northeast, and we do, we now have students enrolled from all the states colored in blue on the map. More women have enrolled, and over half our students belong to the scheduled tribes. We have a small but accomplished core faculty who have been very successful in raising research funds competitively. Our current staff strength, including our research staff, is over 35. But we also have a remarkable panel of adjunct faculty from across the world. For example, Laura Downey, a health economist from the Imperial College, Mark Wilson is an epidemiologist from the University of Michigan, Aritra Das is an evaluation specialist from CARE India, and the others there are at the top of their respective fields. They provide invaluable support to us, especially in mentoring our PhD candidates. These are Meghalaya's figures for 2020 and 2021 plus 2 results. From that you will see just 12 to 17% of our students from the state get into a science stream. The vast majority take arts and potentially contribute to the growing figures of educated unemployed or perhaps unemployable. In more developed states such as Tamil Nadu, Kerala, Karnataka, Maharashtra, the proportion of science plus 2 students ranges from 70 to 85%. We at the Institute have been brainstorming for solutions and offer one small solution. Colleagues at NIGRUMS and other institutes have often expressed a need for well-trained research officers. The principal secretary here have been urging us to start undergraduate courses to keep in line with the national policy. Thus was born the Bachelor of Public Health course at IIPHS Shillong. Students who have passed 12th standard in any stream are eligible. Year 1 will include a bridge course in science and human biology. We have vetted a draft curriculum with the academic advisory councils, whose members include stalwarts like Professor J.P. Mulil from CMC Vellore and others. We are also a regional resource hub for health economics, an initiative of the Ministry of Health. The Center does cost-effective analysis of health technologies and intervention, including budgetary implications for the ministry. Examples of our work include a costing study of Manipur's Pradhan Mantri Jan Arogya Yojana scheme, which is ongoing. Our team is based in Manipur right now, collecting data as we speak. Another one is a cost-effective assessment of thiamine supplementation in pregnant women to reduce infant mortality rate in Assam. In Meghalaya, last year we had completed an evaluation of the claims data of the Mega Health Insurance Scheme. And exciting new possibilities are coming our way. Infections that have an animal host and rely on an intermediate insect vector are referred to as zoonosis. The DBT Wellcome Trust India Alliance has funded us to set up a zoonotic and vector-borne disease research and training center in 22, and you will shortly be hearing the inaugural of that center. Once again, my hearty congratulations to the graduating batch of 2019. You persevered and multitasked through a pandemic. Well done. Thank you all.
Thank you, Professor Sandra, for the Director's report. I now call upon Dr. Ekta Chaudhary, Student Representative of the 2020 MPH batch, to give her welcome speech. Over to you, Dr. Ekta.
Good morning, everyone. Greetings to all the dignitaries, faculty, students, and the new BPH candidates. I'd like to give a hearty welcome to you as you embark on a new adventure today. My name is Dr. Ekta Chaudhary, and I'm a member of the MPH 2020 class. From 2020, you all must have understood that our classes fluctuated from offline to online mode. Yet, our extremely knowledgeable and dedicated teachers ensured that learning continued. This is for the new BPH candidates. If you take your classes and assignments seriously, every module here will help you level up. Prior to joining IIPH, I received completely memory-based educational training similar to what you all have likely received to this point. However, the learning experience you will have here will be modular, with your abilities being polished and field application being taught. And this may be difficult for you at first because it is new, but it will eventually help you bridge the gap between academia and the professional world. Our professors here are very approachable, so make the learning experience here as engaging as possible and don't confine your learning to the classroom. Get ready to embrace this new experience and have a happy learning. Thank you.
Thank you very much. Moving right along, it's my pleasure to introduce the guest of honor, Shri Sampath Kumar, IAS, Principal Secretary of Health and Family Welfare, Govt of Meghalaya. Shri Sampath Kumar holds a master's degree in public administration from John F. Kennedy School of Government, Harvard University. He has more than 15 years of leadership experience, 10 years in the IAS, over 6 years in the non-profit sector. He has experience in finding solutions to poverty reduction, women empowerment, rural development, and disaster relief. He played a significant role in drafting the Social Audit Act of the Government of Meghalaya. Sir is an ardent believer and a supporter of public health. I now invite you, sir, to speak a few words.
Good morning to all of you. So I would like to pay my respects to our Honorable Minister, Shri Sangma for being the chief guest for this function. And also I thank Dr. Sandra for Director IIPH for inviting us for this very important occasion for the institute. I also, basically, pay my respects to everyone. In fact, I can see the directors of health services are here, both the director DHS, MCH, and also research. Dr. Tariyan and Dr. Lindem are here, and Dr. Sunil Kaul. Dr. Sunil Kaul is the board member of IIPHS Shillong, and also he is also board member of PHFI. He is one of the very renowned, doctors working, for in fact the rural areas, and he has brought a lot of innovative models. And also I thank the MLCU person, the registrar who is here. Dr. Lalu. so everyone. So basically, I'll be very brief. Just two things I wanted to share it with you. Why it is so important, what we are doing and what you're all doing. Needless to say, public health is the most important sector today. Just believe in it. Everyone on the earth believes that public health is most important. You cannot neglect it. And this has been taught by a small virus called COVID. Honestly. So we have to understand that this is something that we are very glad that in the state, with the leadership we have, we are really taking it forward. Not only to help our state, but entire region would be benefited. So that is the goal. The second thing I also want to tell you that this is a very important thing. Not many. In fact, this is also important to know. Everyone should know the connection between the research, and the government, and also the people sector is so important. We call it, I call it a triple helix model. Research, government, and the entire people sector that includes, the hospitals, people, everything, So it's this connection is so important because, if you have that interaction, more interaction means more growth. This was actually shared by one very good professor from UC Berkeley. California, you heard of this Bay Area. Bay Area is the place where I think the Google, Apple, every tech company stays there, and so that place has grown because of this interaction. The government and the universities like Stanford, Berkeley, and other universities, and the entrepreneurs like Steve Jobs and the other now Sundar Pichai. So it's essentially that interaction is very, very important to really find out solutions, to bring innovations. Through innovations only we will create value. So to create more value, we require more interactions. So we are very consciously working on that interface, and I'm very glad that today we have a batch is passing out, and our Honorable Minister is here, Mr. Sangma, who has been really very passionate about really taking this entire public health, entire health systems into a different level. Essentially, our goal is to create 10 years of additional life to the people of Meghalaya. What does it mean? Currently it is 62.5 average life expectancy. Our idea was that we really have to increase the life expectancy to at least 10 years, average life expectancy. So to do that, we all have to work together with a lot of action is there required, both from the supply side, that means service delivery, and also from the demand side, where actually how people are sensitized, mobilized, and are able to access the health services, how we are able to bring that positive health-seeking behavior among the people. So we are going to focus a lot. That's again a domain of public health. So with this, I would like to again congratulate all of you. I also thank the IIPHS Shillong, Dr. Sandra and her team to come out with this BPH module. This is again another game changer, hopefully, because if you have more, because this is where we can create employment opportunities. At the same time, we can create a lot of value through the people who have been trained under these programs. So thank you very much and wish you all the best.
Thank you, sir, for highlighting the importance of public health to the audience. Professor K. Srinath Reddy, President, Public Health Foundation of India, will now give the keynote address. Professor Reddy is traveling with the Vice President and conveys his regrets about not being here with us today. Professor Reddy formerly headed the Department of Cardiology at the All India Institute of Medical Sciences, New Delhi. Under his leadership, PHFI has established 5 Indian Institutes of Public Health. Professor Reddy was appointed as the first Bernard Lowndes Visiting Professor of Cardiovascular Health at the Harvard School of Public Health. He presently serves as an adjunct professor of epidemiology at Harvard. Professor Reddy holds advisory positions in several national and international bodies. He has over 560 scientific publications. He is also an adjunct professor at Emory and Sydney universities. He is the first Indian to be elected the National Academy of Medicine, USA. He was awarded several prestigious international, national doctorates and fellowships. Professor Reddy is a Padma Bhushan awardee. He is also an advisor to the government of Odisha and Andhra Pradesh on health. We'll now play the Professor Reddy's keynote address.
Namaste. My salutations to the dignitaries, greetings to colleagues at the Indian Institute of Public Health Shillong, and my very best wishes to the students who are embarking on an exciting academic journey as students of Bachelors of Public Health program, which is being launched today. Public health had long been neglected in Indian planning and in terms of resource allocation. But during COVID-19, we have seen how vital public health is for development, for protecting people's health, and also because failures in public health will lead to failures in our economic development and cause social disruption. With this, we must begin to understand that India's health system needs now to be reinforced with much greater capacity in public health. We have not adequately invested both in terms of infrastructure as well as in terms of human resources who have the required skills for delivering public health programs. And we have paid a penalty for that over a number of years in poor health indicators for India. Indeed, our health performance has lagged far behind our economic development. And we are constantly reminded during the COVID-19 period that even economy cannot be taken for granted if you continue to underinvest in public health. I believe that economy, whether national or global, will keep slipping on the banana skins of public health failure unless we start paying much greater attention and do so in a sustained manner, not merely sporadically during periods of public health emergency. But then what is public health? Many people think of it merely as water, sanitation, hygiene, inspecting food adulteration, and so on. All of them are very important activities and are related to public health. But public health is also much broader. Public health deals with the identification of the various determinants of health which act at the population level and influences them in order to impact upon health at the individual level. So it looks at risk factors and determinants of health which operate at the population level and identifies how they can be modified so that the health of people can be promoted, protected, and preserved, and even redressed through a well-designed health care system. So we are really dealing with public health through policies which impact in a population-wide manner, for example, tobacco taxes, or the nature of taxes that we levy on unhealthy foods, or the subsidies we provide to healthy foods, or we are dealing also with systems. How do we set up systems, both within the health sector as well as other sectors, for example, environment, food and agriculture, so that ultimately we achieve the objective of health and well-being of the population. We deal with services. How are programs configured? How are they delivered? How are they monitored? How are they evaluated in order to ensure that they're achieving impact and impact with equity? So these are all the issues that we deal with in public health. But we also deal with community engagement, because people's participation is absolutely pivotal for the design and delivery of public health programs. So all of these are actually brought together on a broad platform of public health. This requires multidisciplinary learning, not just medical sciences, but many other sciences. We require a variety of life sciences, including environmental sciences, planetary health, and we require quantitative sciences like epidemiology, biostatistics, demography. We need social and behavioral sciences, like, for example, anthropology. We require in communication sciences. We require social sciences. And we also require a variety of management sciences related to the health system, like healthcare technologies, assessment of that. We require health management. We also require to partner with other disciplines like public health law, public health engineering. So public health provides you a very broad platform for action in multiple sectors. And therefore, after you do your bachelor's degree, it is possible that you may go in for a master's of public health and do further specialization, for example, in infectious diseases, or in what are called non-communicable diseases like cardiovascular diseases and cancer, or you may look at health policy and systems. But you may actually be working in food and agriculture. You may be working in urban design and development. You may be working in environment. But everywhere there is an opportunity for you to protect and promote public health. So having a bachelor's degree in public health is very important for the healthcare system if basic competencies are provided in a variety of areas like health promotion, disease prevention, investigation of outbreaks, of surveillance, of surveys, and building in some of the skills of qualitative and quantitative research. All of them are important for the health system itself. But well beyond the health system, every other sector vital to human development can be influenced through a public health perspective. That is why we believe that having a bachelor's in public health opens very many avenues for advancing health in this country. And we do hope that not only the health system of the Northeast is going to be substantially strengthened, but we will see health in a multidimensional manner being advanced across all of India through multiple sectors. So bringing in this confluence of multidisciplinary learning for multisectoral application is going to be the major benefit of this Bachelors of Public Health program. And certainly you can advance in many directions, but ultimately ensure health of this country is fostered in a very definitive manner by several inputs in multiple sectors. And I believe the kind of learning that you're going to get in this particular program is going to prepare you much better than most other graduates in other disciplines for meeting the complex challenges of development which we face today, because we deal with multiple complex systems or complex adaptive systems, as the COVID-19 pandemic has shown us. Health, environment, nutrition, urban development, all of these are relatively complex adaptive systems. So having a broad-based awareness of some of these elements and bringing in multiple disciplines together, even at the undergraduate stage, is going to prepare you much better to assimilate knowledge even as you further specialize. And that will make you much more competent and capable development agents as you move along in different pathways in your life. Wish you the very best as you move along.
Thank you, Professor Ali, though he's not here. Apologies for the delay. Now it's time for the much-awaited event. I request Dr. Eva Lalu, Registrar, MLCU, to take over the presentation of the awards.
By the authority invested in the university to institute and award degrees and diplomas under Section 8, Subsection 1, Clause 4 of the Martin Luther Christian University Act 2005, read with Section 2F and Section 22(1) of the UGC Act, I declare that the candidates presented for graduation at this program has satisfactorily completed their prescribed course of study and are eligible for the award of the degree and certificate for which they are presented. It is my pleasure to announce the names of the graduates in the august present of this gathering. As I call the name, I request the graduate to please come forward and collect your certificate and the sash, who will be presented by the Minister, Mr. James Sangma, and also by the faculty of the IIPH. Master of Public Health, Almachi C.H. Marak. Dr. Easter Gif Tarian Pajat. Dr. Johid Har. Dr. Kuru Kanya. Dr. Maumi M. Marak. Dr. Novarina M. Marak. Dr. Pallavi Datta. Dr. Penkhambor P. Lindor. Dr. Valerie, thank you. Dr. Victoria Ricci Tariang Momin. Geniality Shilla. and Olivia Mazumdar, in absentia. Next, Certificate of Merit in Public Health, Mrinmoy Barman, Priti Gongo, and last, in absentia, Chiranjit Mahanta. Thank you so much. Once again, on behalf of NSU and IIPH, we congratulate the first graduates of IIPH. Thank you.
Thank you, Dr. Yuvamohan Lalu, and congratulations once again to the batch of 2019. May I now invite Dr. Momi M. Marak, Valedictorian, batch of 2019, to address the audience.
Good morning to one and all present here. Shri James K. Sangma, Honorable Minister, Health and Family Welfare. Shri Sampath Kumar, IAS, Principal Secretary to the Government of Meghalaya. Dr. Iwoman Lalu, Registrar, Martin Luther Christian University. Professor Sandro Albert, Director, Indian Institute of Public Health, Shillong. Senior officials of Health Department. Teachers and staffs of IIPHS Shillong, students, families, and my dear friends. I am Dr. Momi Marak. It is an honor for me to stand here on behalf of the first batch of MPH of the IIPHS Shillong to share our thoughts and deliver the valedictorian speech. On the fine day of 21st August 2019, we, the 15 students from different educational backgrounds, ethnicity, and age group, started our journey as the first batch of the MPH program in a tiny, cozy classroom. Although a diverse group, we had one thing in common. We did not have a clear understanding of public health. We were asked if we know who Jon Snow was, to which one student answered, Jon Snow, the famous character of the Game of Thrones series, only to learn later that Jon Snow is the father of epidemiology. After working as a medical officer for 10 years in the government sector, I was a little nervous to get back to college, but IIPHS Shillong made me feel like I can do this even as an older adult coming back to study. Once in the program, I found that the professors were knowledgeable and approachable. I felt as a student that I was the priority at all times. After 2 years, we stand here as successful MPH graduates. This journey has been challenging, demanding, and difficult for most of us, especially with the COVID-19 pandemic. Many of us who are already in the state service were recalled from a study leave due to a positive manpower in the state. For some of us, being a parent, working as a healthcare worker in the pandemic, and continuing as a student was overwhelming. But we are much thankful to our institution and teachers for being there for us, encouraging us and giving us time when some of us were on the verge of giving up. It is through their continuous support that we could take the pandemic rationally and be favored to study public health in times of a pandemic. This journey was also possible because we had support from our fellow students, our families, and our friends. MPH training had changed my view of health and healthcare that I never got as a medical student. I've learned different aspects of healthcare, how to problem solve on a systems level, evaluate the strengths and weaknesses of programs, and a better understanding of the way the healthcare delivery system works. In the field of public health, decision-making is data-driven. I will never look at data in the same way that I did before I joined the MPH course. I have now learned to question data and understand that data must first be useful to us collecting it. In these 2 years, we have learned different subjects from sexual health, environmental health, to research methods. All of us have also worked on research topics of public health importance. When I joined this course, I did not know that I would always be learning, and there are many more aspects of public health that are interesting and engaging. Public health classes also involve a lot of group work that allowed us to make friends, pool our ideas, and see problems from different perspectives that led to meaningful, thought-provoking discussions. 2 years flew by like the blink of an eye. Class of 2019, we graduated through a global pandemic. When all odds were against us, we still did it. Congratulations. I wish you all more accomplishments and success in life. To the upcoming batches, good luck. You are in safe hands. Do your best and do not forget to live your life with joy. Thank you.
Thank you, Dr. Momin. It's my privilege to introduce the chief guest, Shri James P.K. Sangma, the Honorable Minister for Health and Family Welfare, Govt of Meghalaya. He holds several portfolios. He is also the Environment and Forest Minister of Meghalaya. He is an ardent environmentalist and is deeply interested in preserving Meghalaya's forest and its biodiversity. Under his aegis, the state of Meghalaya has revisited the foundational principles of livelihoods, quality of life, agricultural practices with the intent of conservation and sustainability. Several pioneering community-led ecotourism models are being currently prototyped in Meghalaya's national parks. On the legislation side, Shri James P.K. Sangma is galvanizing political consensus, introduce climate change and conservation curriculum in schools. But to us, although he recently took over the health portfolio, we are delighted at his active interest and enthusiasm for public health. Once again, welcome, sir. May I request you to please address the gathering.
Thank you, Doctor. Thank you, Dr. Lewis. Dr. Sandra, the Director of IIPH. Mr. Sampath Kumar, our Principal Secretary, Health and Family Welfare, Govt of Meghalaya. Dr. Lalu, Registrar of MLCU. Dr. Rajiv Sarkar, Associate Professor. Dr. Sunil Kaul. All the students who have graduated today, who have been conferred with the MPH degree, other students, faculty members of the IIPH, all my dear friends, ladies and gentlemen, a very good morning to each and every one of you present here. I would like to just start off by saying that I feel so honored and privileged to be here today in the truest sense in this convocation ceremony, because this subject of public health, although for me it's been something that I have come across very recently, courtesy Dr. Sandra, but it is something that I hold very dear to my heart. And to be here today in this program, in this function, and giving out the degrees to our newly passed out students who have just cleared their Masters in Public Health, it's really something that I will be cherishing for the rest of my life. And thank you so much to Dr. Sandra for giving me this opportunity. I'd like to start off by saying that this is a great opportunity for me as well to learn so much. After listening to Professor K. Srinath Reddy, it was really such a refreshing talk that he gave, the keynote address, and it's something that for me, a lot of takeaways, a lot of information, and something that will help me and will guide me in my future course as Minister in charge of Health and Family Welfare. We all know health as much as it is an individualistic concern. It is also now a national concern, has always been for that matter. The prosperity of any country, any nation, we all heard Professor Reddy just mention about it. It depends on how robust its infrastructure is in keeping its population healthy. And also the other way around. A healthy population results in a robust infrastructure. And I believe all the graduates of the Masters in Public Health today and the incoming batch of the Bachelors of Public Health are going to be very valuable additions to this system of public health. This is coming at a very opportune and especially a very crucial time, given how our workforces have witnessed the breakdown of public health, not only in India but all across the world due to COVID-19 pandemic. Today, as much as it is a day of celebration for those who are graduating, it is also one where we recognize the importance of public health for our state, for our country, especially where I stand. And I take this opportunity to congratulate all of you on your convocation, on your graduation. Beyond the numbers and statistics, an important lesson that COVID taught us is that there is a human angle to public health, which is not restricted to just infrastructural support. It is also about providing accessibility and affordability to all sections of India's population when it comes to ensuring an effective health service. Today, we are having this event in person, but for over 2 years, and to an extent when we had Professor Reddy virtually, even today also we're having something of a virtual event as well. For many students and professionals, it took a serious toll on their mental health as well. We heard the Valedictorian speak about how challenging it was. And as a parent, I understand how difficult it's been for us as parents to handhold our children, see through this difficult phase where they had to go through online classes. COVID was such a big disruptor, and it has been for the batch that just cleared their Masters in Public Health, as Dr. Mwami mentioned. And that really is something that I must, say hats off to all of you. It must have been such a challenge. It must have been so difficult. Dr. Mwami mentioned how difficult it was, really. Hats off to each and every one of you for that. I believe that today the idea of public health is also to promote wellness in a physiological, mental, and emotional aspect as well. We need to move away from an exclusively clinical medicine-based system to making concerted efforts towards public health through a multidisciplinary and a multi-sectoral manner. We realize that we need to integrate streams of knowledge from diverse disciplines, bring together learnings and perspectives from life sciences, quantitative sciences like biostatistics and demography, social and behavioral sciences like economics, anthropology, political science, ethics, and management, that was as mentioned by Professor Reddy. But we all understand that this is not going to be easy, because for India, the new agenda for charting out a pathway for public health did not begin after the pandemic. India was already battling a paradigm shift, one that involved an epidemiological transition, which came with a rising burden of chronic non-communicable diseases, a demographic transition, where despite the country being one of the youngest, we have a slowly increasing elderly population. And of course, the talk of the day, environmental transition, which is contributing its own share towards catalyzing diseases. And on top of that, there is the unfinished agenda of maternal and infant mortality, HIV/AIDS, vector-borne diseases, and other communicable diseases. All of this combined continues to exert an immense strain on the overstretched health systems of our country. This is impeding the formulation and implementation of policies, as well as access to quality health services in our country today. The point, I feel, is not to spread an environment of apprehension. That is not my intention, or to spread fear. More than anything, it tells me where the youngest and brightest minds of this room are going to focus their energy tomorrow for solving some of the most compelling challenges of a developing state and a developing country. In the past and in the ensuing decade, there has been an increasing number of policies to allow for the fluidity of private investment in health systems, which are being forced to make abrupt switch to market-based governance styles. Unrelenting advocacy for the same is also reducing the role of the state in public health, which in turn is allowing for an overall compression of public expenditure. The common perception is that public systems of health are weak and the more expensive private systems are efficient. This is the perception, very unfortunately. As elitist as this pathway is, this is coming at the behest of opening doors for the public to slide into indebtedness without sufficient safety nets. Efficiency of public health of any population is not only the record of mortality and morbidity, but it is also a record of its resilience based on mutual solidarity and traditions of self-care and indigenous medicine. Such assets are invisible to the planners and the professionals for whom efficiency is the only concern, not welfare. The resilience of the public health system can only be enriched where the state directs strategies and policies keeping good health of all its citizens as a subject of welfare in accordance with the constitutional mandate. Only within such a framework can the private sector be engaged as an additional instrument or a partner for achieving shared public health outcomes. Similarly, indigenous health systems must be promoted to the extent possible to become another credible delivery mechanism because people naturally have faith in them. Public programs in rural and poor urban areas engaging indigenous practitioners and community volunteers can prevent much seasonal and communicable diseases using low-cost traditional knowledge, which is based on the balance between food, exercise, and moderate lifestyles. In fact, this is where the private sector can play a vital role and a public role, and in a much welcome direction, because it would inform the course of future state-led healthcare policies in the country. To conclude, COVID has shown us why public health is a concern of national security. As Mr. Sampath Kumar said, a small germ like COVID has shown us and brought us, the whole country, to its knees. And this is not because you or I have been affected. It is because the majority of our country who have not had the access to education, who have not been able to afford sanitation and open spaces, and have had less access to quality healthcare, time and money, are the ones who have taken the major hit during the pandemic. Therefore, public health service for all of us here should be fully organized and incorporated into our governmental system, because the returns are 1,000-fold in terms of economic benefits and infinitely more in reduction of suffering and promotion of human happiness. I once again congratulate all the pass outs who have graduated today with their masters in public health. I, from the bottom of my heart, thank Dr. Sandra for all the initiative. I know it's not been an easy journey. There are so many challenges that she has faced and will be facing in the future. But I believe that all of us collectively, since we know how important public health is, I think that we can overcome any challenge, any problems that may come up in the future. And I look forward to that kind of partnership with the IIPH, with Dr. Sandra, the entire faculty, and also with the students who have passed out today and those who are going to be coming up, the new batches of the MPH and the Bachelors in Public Health. I really look forward to that kind of partnership, to that kind of relationship, and I believe that this is the way forward for us as a state in terms of healthcare. So once again, thank you so much, Dr. Sandra, to the faculty members at IIPH for really giving me this honor, this privilege to be part of this function and to be handing out the degree to our students who have passed out with the Masters in Public Health. God bless each and every one of you. God bless the IIPH and all the endeavors that lie ahead of them. Thank you so much. Kublai Shibun, Matela, Jai Hind.
Thank you, sir, for that wonderful address. We have now come to the end of the program. I invite Dr. Rajiv Sarkar, Dean IIPH Shillong, to deliver the vote of thanks.
Thank you, Dr. Melissa. On behalf of the Indian Institute of Public Health Shillong, I extend my sincere vote of thanks to our Honorable Health Minister, Shri James P.K. Sangma, who is the chief guest for this occasion, who has taken time off his busy schedule to grace this occasion. Thank you so much, sir, for coming and handing over the certificates to our graduating students. I think this was a very proud moment for them. Also, sir, thank you for highlighting the importance of public health. And as you mentioned about and as the valedictorian, Dr. Nomi also mentioned about the challenges of online teaching. As a parent, apart from a teacher, I can attest how difficult it is, having faced both ways. So thank you once again for highlighting that. Indeed, the pandemic has kind of shown us the importance of public health and the need for a public health training in our country. I'd also like to thank Shri Sampath Kumar, IAS, our guest of honor, for highlighting the importance of evidence-based decision making, and having worked with the Government of Meghalaya Health and Family Welfare Department on different aspects of COVID-19 pandemic, I can attest to the fact that the approach of the government towards this pandemic has always been evidence-based. And that, I think, sets apart Meghalaya apart from a lot of other states and even other countries in terms of how the pandemic was approached. So thank you, sir, for highlighting that in today's speech. I'd also like to thank our dignitaries, Dr. Rita Tairam, DHS MCH, thank you, ma'am, for coming. Dr. H. Linden, DHS Research. Dr. Rennie, Dean Outreach, Martin Luther Christian University. Dr. Eva Monlalu, Registrar, Martin Luther Christian University. Dr. Sunil Kaur, our board member of PHFI. And Dr. B. Thava, Registrar Nursing Council, for being here. Thank you so much for gracing this occasion. I'd also like to thank the members of the press who have come here. Thank you very much. Professor Sanders started by outlining the origins of the IIPHS Shillong, highlighting our evaluation system and our teaching and our pedagogy, which I think sets us apart from most of the institutions that teach public health in this country. Our students are attest to the fact how that worked, and I'm really hopeful that we would stand apart in terms of teaching and in terms of research. This is a watershed moment for IIPHS Shillong. While on one hand, we are welcoming our first batch of undergraduate students who would be the flag bearers of the public health going forward, we are saying goodbye to our first batch of the Master of Public Health students. It has been a tremendous honor to be a faculty, to teach you, to interact with all of you students of the first batch, and I'm really looking forward to your contribution to public health, not only in Meghalaya but in the Northeast and India as well. I look forward to hearing your success stories and learning more from you as we move forward. Once again, a hearty congratulations to all the graduating students. I'd also like to thank Professor Shri, President PHFI, for his keynote address and for emphasizing the importance of public health and how it is interlinked not only to the health indices but also to the economy of the country. That is something we rarely talk about, the multidisciplinary nature and how our public health impacts all the spheres of life. And I think COVID again has brought this out in the forefront. Thank you, sir. I wish you could be present amongst us and to talk to our students in person. Dr. Mommy, you mentioned about the Jon Snow story. I can assure you that there are others also who join public health thinking Jon Snow is a character from the Game of Thrones. At least I'm glad that we have been able to break that myth, but yeah. But I think Jon Snow's contribution in a way brings forward what really is everything about public health. The way that he approached the cholera outbreak by removing the pump handle, going against all the odds, all the known facts at that point in time that cholera was created by, it was an airborne disease created by some miasm, demonstrating the fact that it is a waterborne disease and it is in 101 in public health. And I'm sure there will be more moments, and one of you, I'm hoping, would be the next Jon Snow. So again, all the best. And to the Bachelor of Public Health students, welcome to IIPHS Shillong. I hope you'll have a very productive time here. We are a small group of faculties, but we are very open. Please do drop in to us if you have any questions, any issues. And I'm sure your 4 years will be very productive and enjoyable. Welcome once more to IIPHS Shillong. Last but not the least, I'd like to thank the staff of IIPHS Shillong. I can see Dr. Jami standing outside. Thank you so much for all the hard work that has gone in organizing this. And you are not alone. I know there's a lot of other people. There is, where is Bandap? Bandap was standing here, he ran off, I guess. Bandap and Carinthia, Rose, Felicita, who else? Bindya, Bari. I can keep on going, so I'll stop here. Thank you very much. I did forget to mention Dr. Meban Kakhongor. Meban is a graduate from CMC Vellore. I know Meban from CMC days. He is also a member of our ethics committee. Thank you, Meban, for coming. And Dr. Twinkle, thank you so much for coming. I didn't notice you till now beneath the masks. Thank you so much again for coming and gracing the occasion. Dr. Twinkle Marat, she's also a member of a board of governors and a member of the executive committee of IIPHS Shillong. Ma'am, thank you very much.
And the welcome song.
Yes, the welcome song, of course. I think it was Himonmi and his troupe and it was done in record short time. So Himolmi, congratulations wherever you are sitting, hiding yourself. Thank you very much. I will end here, again welcoming the Bachelor of Public Health students and thanking the graduating batch, wishing them all the very best. Thank you.
Thank you, sir, for delivering the vote of thanks. That brings us to the end of the program. Thank you all for giving us your valuable time. The refreshments are arranged outside. I request all the MPH graduates to gather us for a photograph with the dignitaries in the garden. Okay? Thank you so much.